Prison employees, by the way, have already tested positive for COVID-19. And according to new data, there are more than 20,000 inmates in the federal prison system who are in their mid-50s or older. So we want to take a closer look at what can be done to protect these vulnerable populations as the virus continues to spread. Joining me now is Dr. Salman Khashoggi. He's a professor of social health and medicine at Harvard University. He's a physician in the Division of Global Health Equity at Brigham and Women's Hospital in Boston. Dr. Khashoggi, you and I were talking about this, the idea that prison populations, you've worked in prison populations before, studying the spread of infectious diseases. This is a really dangerous place for us to have people in close quarters who have no control over their ability to social distance, if you will.
Yeah, absolutely, Ali. When you think about it, when you're in a prison, you are crowded together and you eat together. You move around in very specific ways. You can't control what you can clean. You can't control how many times you're washing your hands necessarily. So there's a lot of issues around prisons. And we've had outbreaks of a number of diseases in prisons, including things like tuberculosis and flu, et cetera. So we know that prisons are at very high risk.
What can be done? What have you seen done to try and accommodate a prison population short of letting people out, which some people are considering and asking for?
Well, you mentioned letting people out. So I think on a very administrative level, people that don't need to be in prisons or jails shouldn't be there. And those are the people that may have trouble paying bail or things like that. They just shouldn't be there. But after that, you can take a number of administrative steps. So the first thing is that you can separate the sick from the non-sick, which means that you have to test people. And you end up with three groups in the case of coronavirus. You'll have people that have it. You'll have those that are exposed to people who have it, and those people should be watched. They should be, in some way, what we're doing at home now, quarantining, and then there'll be a group that doesn't have it, and they can be separated. So you need to have three